The topic of the tutorial is nasal cavity and paranasal air sinuses. I, Dr. Alpana Kesar, will be covering this topic under the following subheads. Nasal cavity will be covered under medial wall of nose and lateral wall of nose. Paranasal air sinuses will be covered under frontal air sinus, maxillary air sinus, ethmoidal air sinus, and sphenoidal air sinus. Nasal cavity. Functions of the nasal cavity. Olfaction is the special sensory function of the nasal cavity that is responsible for the sense of smell. Nasal cavity helps to trap and remove particulate matter from the airway present in the respired air. It also helps to adjust the temperature and humidity of the respired air. Regions of the nasal cavity. Each nasal cavity consists of three regions. They are the nasal vestibule. This area is nasal vestibule. It is a small dilated space present just internal to the nares. It is lined by skin and also contains hair follicles. Respiratory region. This is the respiratory region. It is the largest part of the nasal cavity and it is lined by respiratory epithelium, that is pseudostratified ciliated columnar epithelium, which is composed of ciliated and mucous cells. This region has a rich neurovascular supply. Olfactory region, which is present in the roof of the nasal cavity, is lined by olfactory epithelium and contains olfactory receptors for the sense of smell. Medial wall of nose or nasal septum. Nasal septum is an osteocartilaginous partition present between two halves of the nasal cavities. It separates the right and the left nasal cavities. Since it is an osteocartilaginous partition, it has cartilaginous and bony components. The cartilage in the nasal septum is septal nasal cartilage. There are two bones that forms the nasal septum. First is vomer, which forms the posterior and the inferior part of the nasal septum. The upper part of the nasal septum is formed by perpendicular plate of ethmoid. The surface of the septum is covered by mucosa. Innervation of the medial wall of the nose. Special sensory innervation of the medial wall of the nose is by olfactory nerve. Olfactory nerve carries olfaction or sense of smell from the upper region of the nasal septum where the olfactory receptors are distributed. The general sensations of touch, temperature, and pain are carried by four different nerves. For ease of understanding the sensory innervation of the nasal septum has been divided into four quadrants. This is the anterosuperior quadrant. This is the posterosuperior quadrant, posterior-inferior and antero-inferior quadrants. The anterosuperior quadrant is innervated by anterior ethmoidal nerve, which is a branch of ophthalmic nerve. The posterior-inferior compartment is innervated by nasopalatine nerve, which is a branch of maxillary nerve. Anterior ethmoidal nerve and nasopalatine nerve are responsible for innervation of most of the nasal septum. Small area of posterior superior compartment is innervated by posterior superior medial nasal nerve. Posterior superior medial nasal nerve is a branch of maxillary nerve. The antero-inferior part of the nasal septum is innervated by anterior superior alveolar nerve. Anterior superior alveolar nerve is a branch of infraorbital nerve. It innervates the anterior teeth in the upper jaw, that is the maxillary incisors and canines, and also innervate a small part of the antero-inferior area in the nasal septum. The parasympathetic innervation or secretomotor nerve supply to the glands present in the mucosa of the nasal septum is by the pterygopalatine ganglion through its nasal branch. Arterial supply of medial wall of nose. For better understanding of the arterial supply of medial wall of nose, the nasal septum has been divided into 4 areas. The 4 areas are anterosuperior, posterosuperior, postroinferior, and the anteroinferior. The blood supply to the anterosuperior part is by the anterior ethmoidal artery, which is a branch of ophthalmic artery, and ophthalmic artery is a branch of internal carotid artery. The posterosuperior part gets its blood supply from the sphenopalatine artery, and sphenopalatine artery is a branch of maxillary artery. Most of the blood to the medial wall of nose comes from anterior ethmoidal artery and the sphenopalatine artery. The posterior-inferior part of the nasal septum gets its blood supply from the greater palatine artery. Greater palatine artery is a branch of maxillary artery. Greater palatine artery supplies blood to the hard palate and gives a small branch that will supply the posterior-inferior part of the nasal septum. The antero-inferior part of the nasal septum gets its blood supply from the superior labial artery. Superior labial artery is a branch of facial artery. Superior labial artery supplies blood to the upper lip and sends a small branch that will supply the antero-inferior part of the nasal septum. The maxillary artery and the facial arteries which supplies blood to the nasal septum are branches of external carotid artery, while ophthalmic artery which supplies the anterosuperior part through its anterior ethmoidal branch is a branch of internal carotid artery. Kieselbach's plexus, Little's area, or epistaxis. A large capillary network is present in the antero-inferior part of the nasal septum and it is called Kieselbach's plexus. It is formed by anastomosis between 3 arteries. They are anterior ethmoidal artery, which is a branch of ophthalmic artery, sphenopalatine artery, which is a branch of maxillary artery, and superior labial artery, which is a branch of facial artery. These 3 arteries will form an anastomosis in the antero-inferior part of the nasal septum called Kieselbach's plexus, and this area is known as Little's area. This area is a common site of bleeding from the nose. Bleeding from the nose is called epistaxis. Lateral wall of nose. Components of the lateral wall of the nose. 7 bones contribute to the formation of the lateral wall of the nose. They are the nasal bone, the frontal process of maxilla, the lacrimal bone, ethmoidal bone with its superior and middle concha. The fifth bone is inferior concha, which is a separate bone, perpendicular plate of palatine bone, and medial pterygoid plate, which is a part of sphenoid bone. The cartilage forming the lateral wall of the nose includes the lateral process of the septal cartilage and the major and the minor alar cartilage. Characteristic features of the lateral wall of nose. In the lateral wall of nose, 3 curved shelves of bones are present. These are known as conchae. These conchae are present one above the other. They project medially and inferiorly. They help to increase the surface area between the respired air and the mucosa of the lateral wall of the nose. These conchae divide the lateral wall of nose in 4 air channels. They are inferior meatus, middle nasal meatus, superior meatus, and sphenoethmoidal recess. Inferior meatus is present below the inferior concha. The middle meatus is present below the middle concha, and superior meatus is present below the superior concha. Between the superior concha and the roof of the nasal cavity is present sphenoethmoidal recess. So, this is the superior concha, middle concha, and inferior concha. This is the inferior meatus, middle meatus, superior meatus, and sphenoethmoidal recess. Other than the conchae and the meatus, in the lateral wall of the nose is present yet another structure called ethmoidal bulla. This is ethmoidal bulla. It's a dome-shaped elevation present in the middle meatus. It is formed by the underlying middle ethmoidal air cells. Beneath the ethmoidal bulla is present hiatus semilunaris. Hiatus semilunaris is a curved gutter just below the ethmoidal bulla. Openings in the lateral wall of the nose. Paranasal air sinuses are present around the nasal cavity. These paranasal air sinuses open in the lateral wall of the nose through various openings. The openings present in the lateral wall of the nose includes opening of the nasolacrimal duct. This is the opening of the nasolacrimal duct. Nasolacrimal duct opens in the inferior nasal meatus. It drains tears from the lacrimal sac into the nasal cavity. Frontal air sinus. Frontal air sinus drains into frontonasal duct. The frontonasal duct opens here at the anterior end of hiatus semilunaris in the middle meatus. Maxillary air sinus. Maxillary air sinus drains here. This is the opening of maxillary air sinus in the middle of hiatus semilunaris, in the middle meatus of nose, just inferior to the center of ethmoidal bulla. Anterior ethmoidal air cells drain into frontonasal duct that opens at the anterior end of hiatus semilunaris. The middle ethmoidal air cells open over the ethmoidal bulla. Both anterior and middle ethmoidal cells open in the middle meatus. The posterior ethmoidal air cells open in the superior meatus, and the sphenoidal air sinus opens into the sphenoethmoidal recess. Innervation of the lateral wall of the nose. Special sensory nerve supply to the lateral wall of the nose is by olfactory nerve. Olfactory nerve innervates the olfactory receptors present in the roof of the nasal cavity. The general sensory nerve supply to the lateral wall of the nose for ease of understanding has been divided into 4 areas. They are anterosuperior, posterosuperior, postroinferior, and anteroinferior quadrants. The anterosuperior gets its sensory nerve supply by anterior ethmoidal nerve, which is a branch of ophthalmic nerve. Postroinferior quadrant gets its nerve supply from greater palatine nerve. Greater palatine nerve is a branch of maxillary nerve. Greater palatine nerve primarily supplies the hard palate and gives a branch that will supply the postroinferior part of the lateral wall of the nose. The posterosuperior part of the nasal cavity is supplied by posterior superior lateral nasal nerve. This is a branch of maxillary nerve. The anteroinferior part of the nasal cavity or the lateral wall of the nose is supplied by anterior superior alveolar nerve. Anterior superior alveolar nerve is a branch of infraorbital nerve. This nerve also supplies maxillary incisors and canines and gives a branch that will supply this quadrant. The parasympathetic innervation of the lateral wall of the nose is from pterygopalatine ganglion via nasal branches. The postganglionic parasympathetic fibers from the pterygopalatine ganglion will supply the glands in the wall of the mucosa. Arterial supply of the lateral wall of nose. For ease of understanding, the lateral wall of nose has been divided into 4 quadrants: anterosuperior, posterosuperior, postroinferior, and anteroinferior. The anterosuperior area gets its blood supply from anterior ethmoidal artery. Anterior ethmoidal artery is a branch of ophthalmic artery. The postroinferior compartment gets its blood supply from the greater palatine artery. Greater palatine artery is a branch of maxillary artery. Posterosuperior compartment gets its blood supply from sphenopalatine artery, branch of maxillary artery. An anteroinferior compartment gets its blood supply from the superior labial artery, which is a branch of facial artery. Superior labial artery supplies the upper lip and gives a branch that will supply the anteroinferior part of the lateral wall of the nose. The maxillary artery and facial artery are branches of external carotid artery. Ophthalmic artery is a branch of internal carotid artery. The blood supply and the nerve supply of both the medial and the lateral wall of nose has been summarized in this table. This is for ease of remembering the blood and the nerve supply of the nasal cavity. Roof of the nasal cavity. Roof of the nasal cavity is formed by cribriform plate of ethmoid and sphenoid bone posteriorly. It is lined by olfactory mucosa with olfactory receptors. The floor of the nasal cavity is formed by the upper surface of palatine process of maxilla anteriorly and the horizontal plate of palatine bone posteriorly. Students, don't forget to like this video and subscribe to the channel to stay updated with the latest exam questions. Paranasal air sinuses. Paranasal air sinus. There are four paranasal air sinus. They are frontal air sinus, maxillary air sinus, ethmoidal air cells, and sphenoidal air sinus. In this visual, this is the nasal cavity, and the air sinus present around it are maxillary air sinus, frontal air sinus, ethmoidal air cells, and sphenoid air sinus. All these sinus are named according to the bones in which they are found. Here again we can see in this visual that this is the frontal air sinus. These are the ethmoidal air cells. This is the maxillary air sinus. Frontal, maxillary, and sphenoidal air sinus are present as single cavities within the bone in which it is found. However, ethmoidal air sinus is not a single cavity in the ethmoidal bone. It rather consists of numerous small air chambers or air cells present within the ethmoid bone, and these are known as ethmoidal air cells. Paranasal air sinus develop as outgrowths from the nasal cavity, and then they erode into the surrounding bones. At the time of birth, the air sinus are not so well developed. However, as the small child grows into adolescence and then into an adult, the paranasal air sinus will keep growing in size. They are all lined by respiratory mucosa. All the paranasal air sinus open into the nasal cavity. The paranasal air sinuses are innervated by branches of trigeminal nerve. This is the anterior view of the skull in which some of the paranasal air sinuses have been marked. These are the frontal air sinus present in the frontal bone. This is the maxillary air sinus present in maxilla. These are the ethmoidal air cells present in the ethmoid bone. This is the radiograph of anteroposterior view of the skull in which some of the air sinuses can be identified. These are the frontal air sinus. These are the ethmoidal air cells. This is the maxillary air sinus. This is the sagittal view of the skull, in which frontal air sinus can be seen in the frontal bone and sphenoidal air sinus can be seen in the sphenoid. This is the radiograph of the lateral view of the skull, in which sphenoidal air sinus can be seen. Here, frontal air sinus can also be seen. Frontal air sinus. In the anterior view of the skull, this is the frontal air sinus. In the sagittal section, this is the frontal air sinus. Frontal air sinus is triangular in shape. It is present in the frontal bone in the lower part of the forehead. Its drainage is into the frontonasal duct that opens in the anterior part of hiatus semilunaris in the middle nasal meatus. Innervation or nerve supply is by the supraorbital nerve. Supraorbital nerve is a branch of ophthalmic division of trigeminal nerve. Blood supply of frontal air sinus is by anterior ethmoidal artery. Ethmoidal air cells. Ethmoidal air cells consist of a variable number of small air chambers or air cells on each side within the ethmoid bone. Maxillary air sinus consists of a single large cavity within the maxilla. So is in case of the frontal air sinus and the sphenoidal air sinus. Each one of them consists of a single air-filled chamber within the bone. However, ethmoidal air cells consist of several small air-filled spaces within the ethmoid bone, and thus it is called ethmoidal air cells. These ethmoidal air cells is divided into three groups: the anterior ethmoidal air cells, middle ethmoidal air cells, and posterior ethmoidal air cells. Each of this group consists of 2 to 5 air cells. Drainage of the ethmoidal air cells. The anterior ethmoidal air cells drain into frontonasal duct, and frontonasal duct which drains the anterior ethmoidal air cells and frontal air sinus opens at the anterior end of hiatus semilunaris. The middle ethmoidal air cells open over the ethmoidal bulla, and posterior ethmoidal air cells open in the superior meatus of the nose. Innervation of ethmoidal air cells. General sensory innervation to ethmoidal air cells is by anterior and posterior ethmoidal nerves, which are the branches of nasociliary nerve. Nasociliary is a branch of ophthalmic division of trigeminal nerve. Secretomotor or parasympathetic innervation to ethmoidal air cells is from pterygopalatine ganglion through the orbital branch of maxillary nerve. The blood supply to ethmoidal air cells is through anterior and posterior ethmoidal arteries. Maxillary air sinus. There are 4 paranasal air sinus, out of which maxillary is the largest air sinus. It is a paired sinus which is present one on each side in maxilla. Maxillary air sinus completely fills the body of maxilla. It is a pyramidal shaped sinus with its apex directed laterally towards the zygomatic bone and base is directed medially towards the lateral wall of nasal cavity. Its relationships are as follows. This is the roof of maxillary air sinus. The roof of the maxillary air sinus is also its supralateral surface, and it is related to the floor of the orbit. The floor of the paranasal air sinus is its infralateral surface, and it is related to the roots of the upper molar and premolar teeth. Posterior wall of maxillary air sinus. It is related to infratemporal fossa. Base of maxillary air sinus. This is the base. The base is the medial wall of maxillary air sinus, which is related to the lateral wall of the nose. Drainage of maxillary air sinus. This is the base of maxillary air sinus. The opening for the drainage of maxillary air sinus is present in its base. This is the base of maxillary air sinus when viewed from inside the maxillary air sinus. We can see that the opening for the drainage is present in the top region of the base. This will make the drainage of maxillary air sinus difficult. The maxillary air sinus opens in the middle meatus of the lateral wall of the nose. In the middle meatus, it opens in the center of the hiatus semilunaris, just beneath the ethmoidal bulla. The innervation or the nerve supply of maxillary air sinus is by infraorbital nerve and also the alveolar branches, that is posterior, middle and anterior superior alveolar nerves, all of which are branches of maxillary nerve. Blood supply to maxillary air sinus is by infraorbital artery and superior alveolar branches of maxillary artery. Sphenoidal air sinus. Sphenoidal air sinus is present in the body of the sphenoid bone. It's a paired sinus present one on each side. Sphenoidal air sinus opens in the sphenoethmoidal recess. The opening for the drainage is present in the anterior wall of sphenoidal air sinus, high up on the wall, so that the drainage of the sphenoidal air sinus is difficult. The relations of sphenoidal air sinus are: it is related above to the cranial cavity, to the pituitary gland, and optic chiasma in front of it. Laterally, it is related to cavernous sinus, and in front and below, it is related to the nasal cavity. Innervation of sphenoidal air sinus is by the posterior ethmoidal branch of ophthalmic nerve and also by the maxillary nerve via orbital branches from the pterygopalatine ganglion, which is secretomotor to it. The blood supply is by pharyngeal artery, which is a branch of maxillary artery. Clinical anatomy of the nasal cavity. Inflammation of the mucosal lining of the nose is called rhinitis, which is a manifestation of common cold. Common cold can be allergic or infective, such as certain viral infections causes common cold leading to inflammation of the mucosal lining of the nose. Little's area is a common site of bleeding from the nose. Bleeding from the nose is also called epistaxis. This bleeding of the nose occurs from a plexus which is formed on the medial wall of the nose by the anastomosis between the three arteries, that is, the anterior ethmoidal artery, the sphenopalatine artery, and the superior labial artery. CSF rhinorrhea is leakage of CSF from the nose. This occurs most commonly at the time of fractures of cribriform plate of ethmoid. Cribriform plate of ethmoid is a weak area in the base of the skull that fractures easily whenever there is a trauma on the head. For example, when an individual sometimes strike a wall or a glass can easily fracture the cribriform plate leading to leakage of CSF from the nose. Infection of paranasal air sinus is called sinusitis. Sinusitis causes purulent discharge from the nose and also causes persistent headache. Sinusitis can be acute or chronic. Maxillary air sinus is the most commonly infected air sinus. Drainage of maxillary air sinus is difficult because its opening is present close to the roof on the medial wall. It is high above the floor of the maxillary air sinus. In chronic sinusitis of the maxillary air sinus, sometimes an artificial opening has to be created in the sinus close to the floor for the effective drainage of the air sinus. Pain caused by maxillary air sinus may be referred to the teeth. The patient may complain of pain in otherwise healthy teeth. The pain of maxillary air sinus is referred to the teeth due to the common nerve supply, that is the superior alveolar nerves. The posterior superior alveolar nerve which supplies the molars also supply maxillary air sinus. So sometimes patient may complain of pain in the maxillary molars which are otherwise healthy. This which may be due to the pain caused by sinusitis that is referred to the maxillary molars. Frontal air sinusitis pain may be referred to the forehead causing headache due to the common nerve supply of the forehead region as well as the frontal air sinus, and that is the supraorbital and the supratrochlear nerves. Some of the important exam questions that are asked from the chapters nasal cavity and the paranasal air sinus include short notes on medial wall of the nose, the lateral wall of the nose, maxillary air sinus, frontal air sinus, ethmoidal air sinus, and sphenoidal air sinus. Students may be asked to describe the four paranasal air sinus as a major question. Sometimes question asked on the nose may be purely diagrammatic questions such as diagram showing the blood supply and the nerve supply of lateral wall of the nose, or maybe the medial wall of the nose. In clinical anatomy, students may be asked to write a short note on Little's area or epistaxis. Students may be asked why is drainage of maxillary air sinus difficult, and students may be asked to explain why a patient suffering from maxillary sinusitis get pain in the maxillary molars.